whole wide world. But before I introduce them to you, we're going to talk today about the murder of healthcare CEO. How does his murder reflect us as Black people? Because there's always things going on in the world. We know. We know that when America catches a cold, Black people catch the flu. How does this reflect what healthcare crisis for African Americans? What's going on with Black American healthcare? And that's what we are going to peel back today. So recently, Luigi Mangione, if y'all know, okay, anyway, he made headlines after being accused of killing the UnitedHealthcare CEO Brian Thompson. Mangione claims his actions were driven by the frustration with America's healthcare system. Can anybody relate to that? I'm gonna ask y'all right now in the chat. Can you relate to the frustrations of American healthcare system? I think all of us in some way, especially us as Black folks, can relate to that. And it's calling it an insult to the intelligence of the American people. That is what he said. And we're going to watch it in a second. So while this crime is so shocking, while it is this alleged crime, his alleged crime is shocking, it actually raises a larger question about corporate healthcare profits at the expense of everyday Americans. And now you have corporations at the forefront of our economy, especially with Trump being in office. How is that going to then affect our healthcare? There's so much to unpack going forward. Policy. What is the mental health state of, especially us, who are the most affected by the quality of the healthcare? So we need to know how this hits us the hardest. The U.S. has the most expensive healthcare system in the world, yet it ranks near the bottom in life expectancy. We do. So for Black people, the disparities are even worse. We face higher rates of chronic illness. We face lower quality health care. And of course, we face systemic barriers that keep us from living healthy lives. Now, what I want to know is, are these inequities just the cost of living in America? Or is there a way to demand better for our families, better for our communities, better for our children, and better for ourselves? What can we, as African Americans, as Black Americans, as FBAs, as all of those things, what can we do as just Black people, people of color in the diaspora that are here in America? What can we do to protect ourselves in a system that wasn't built for us? I want to ask you that question, audience. What can we do in this country for a system that was not built for us? But before we get into it, I want to introduce you to the most beautifulest, the most fabulous, the most wonderfulest queens on the planet, y'all. All right, we got Big Coach, Dr. Felice. She is a licensed clinical mental health counselor, and she's a coach. And then we have Miss Vanessa Gopal. She is an entrepreneur and an international travel advisor. Get your travel on. If you want to travel, you call Miss Vanessa. And then we have all things pop culture, the We Wealth activist. And she's fabulous. The activist who is fabulous, Miss Athena Gardner. Ladies, that was quite an intro, huh?
Yes.
Y'all like that? Ooh, I'm good. I'm good at what I do. I just want to let y'all know. But anyway, I'm just kidding. Let me ask you a question though, because there's been a lot of news around this, and it was very shocking when we saw it. What was the first thing that you thought, Dr. Felice, from your perspective? And I wanted to come from your lens as a clinical therapist, and just an American and an African American and a woman, from all of those different perspectives. What was your first thought when you saw this?
Well, I do know. Okay, I can be honest here, right? That if one of our boys did that, would they be getting the same reception, right? And so, because I know that there's a huge divide and what that would have looked like, I don't see him as a hero, but a vigilante. And I just think I get it, don't get me wrong. I get it, because as a therapist, I shared last week on the podcast that, a lot of therapists don't even take insurance because of the buffoonery with it. Like literally, I was sharing, I could see somebody a whole lot of times before they cut me a check. And so, like, it's just ridiculous. And then there's all these different things like, oh, you didn't have the right descriptive on it. You didn't have the right this on it. And so they put it back into the wheelhouse, right? And just keep running it. So do you know how much time that takes? So a lot of, so like, I can't even deal with the administrative because we could be on the phone, no joke, for one person for 2 hours and still not get the right answer or get our issue fixed. And so I totally get it. So if you think I'm going through it just as a therapist trying to get reimbursed, can you imagine what the average American is going through for a claim? So I get, and you know, they said the CEO was making what, 10 million? Not saying I never say anything about people's change, right? Or coin. But $10 million, and he's not experiencing the very thing that the people he is called to serve is experiencing. That's ridiculous. That divide is ridiculous. So you get it, right? And you get the anger and the frustration. And I think that this guy right here, you know, from reading everything that y'all shared, it sounds like he was also suffering from depression. So it wasn't that he just one day woke up and said that I want to be a vigilante and kill a CEO, right? This was something that was brewing for him and with him over time, unchecked. Right. And that's what it looks like when you don't get help when you're experiencing and going through things.
You know, it's so funny. I'll address that in a minute, but it's really sad. And one of the things you said is if it was our boys, now would they have the same compassion and empathy for him? Would he be a vigilante? If he was Middle Eastern, would he be a terrorist? If he was Black, would he be a thug? You know, all those things considered. The headline said a frustrated Ivy League student allegedly strikes back at UnitedHealthcare CEO. Vanessa, what was your initial thought from your perspective?
I mean, it was a lot of things going on, but I mean, I feel like I could understand. For one, I agree. If it was our boys, it'd be different, or if it was someone who was the Middle East, it would of course be different. I think that's a given in America. But I think it was kind of shocking because I don't think we've ever seen someone openly, and it was so open the way he did it.
And he
Right?
smiled.
Yeah, and he smiled, and it was just like, but I definitely can understand the frustration of the healthcare system. I've shared my story with almost dying in the healthcare system, being a Black woman, which is why I'm a big advocate of anything policy related to Black maternal health. Um, it's frustrating. It's like even when you go to the doctor, you know, we have some doctors in our family who have told me like if you're on state funded medical insurance, some of the doctors and the other colleagues will tell, you know, them, hey, you can only spend 5 minutes with this patient. That's all we have, 5 minutes. Tell them to come back for another appointment. Otherwise, we're not going to get paid. So I think when you allow corporations to run healthcare and it just becomes for profit, you lose everything it's supposed to be about for people. You start seeing people die. I mean, there's no incentive to treat people the way that you should treat them. I mean, doctors have to get paid, therapists have to get paid, people have to get paid. But when you look up, you see all the executives getting paid, not the actual people on the ground. So I think hearing it from all levels, you know, it's really the patients who get the short end of the stick. So I completely understand the healthcare frustration and how people are responding and sort of looking at him like a vigilante hero. But I don't think we would have that same, you know,
Opinion,
opinion.
lens,
Thank you, opinion if he was
passion,
Middle Eastern or
empathy.
yeah, or
Yeah.
yeah. So, but I do think that there is something to be said, right, about the way that people are responding to this man's death. There's no empathy, right? I don't care. I went and looked through every comment. I see people saying, well, you know, when you deny claims, when you kill people, it's very much so you can see that there is a problem in American healthcare system by looking at the response of something like this.
Right. Thank you. What about you? And because I know you came over here when you were younger, but it says that we rank the bottom when it comes to healthcare. And you looking at a country like Jamaica, and it being as impoverished as it is this an upgrade?
It's very much so an upgrade. I remember, and I think the difference growing up in a developing country like Jamaica is you understand the importance of health, and we have a different approach to health because one, a lot of people cannot afford the healthcare that we do have, right? And two, the systems and things we have, of course, are going to lag behind the United States because the United States have more money and resources. So a lot of our health concerns, we practice holistic health. The thought is to avoid going to the doctor, hospital as much as possible. So there's all these herbal remedies and things that we do. I remember taking like cod liver oil and all kind of different things.
All them old remedies our great grandparents used to have.
All those old remedies.
Sprain ankle, like put some cod liver oil.
Also, our lifestyle is different. Our food is different. When I go to Jamaica and I go to the supermarket there, it literally look like the fruit and vegetables are literally picked off the ground and just saran wrap.
Oh, with dirt on it.
Like there's no I saw dirt on some of it before. There's no processing like we do here. Like the size of things are actually a natural size. You can tell that, and everyone practices a more healthier lifestyle. Our farming, our fish, and everything literally comes from the market. So I think our health outcomes are different because even though we are a nation lagging behind in resources, I think we outperform on a health wise. I remember my dad telling me his doctor was saying like he has the best health of a man his age, and our diets, we don't eat a lot of fried food typically. A lot of our food is steamed, grilled, sauteed, stewed. So even in my dating experiences, I noticed the diets of the men that I date here, I was like, this is like a Black American diet or whatever, because we don't eat a lot of there's differences.
Y'all don't eat chitlins, y'all don't eat pig feet, y'all don't eat hog maw. Well,
hell no. But what I will say is this: when it comes to healthcare in this country, that there's a lot of changes that need to be done. And I talked about on a previous episode that a lot of Americans are frustrated and angry about the ability to afford rent and basics, right? And that has trickled down in sentiments towards migrants. But also, I think, as in this case in point, has trickled down to people are going to be reactive and doing these violent displays to get a message across, right? To get a message across that we are tired of being abused financially by these different systems of control. UnitedHealthcare made $50 billion in just denying claims. Denying claims. They were using AI technology to filter out claims and seeing what they could deny to avoid having to pay people, and profited $50 billion. So something definitely needs to happen.
All right, I understand. And we're going to talk more about it when we come back from a commercial.
Hey, if you're just tuning in, you are watching Fly Nubian Money, where we help you master your mindset and maximize your money. I am Tiara Williams. I'm also known as Miss Black Hollywood, and I am the proud producer of this show. So I hope that every day when you join us, you leave a little smarter than you came, because that's the point. Otherwise, why are you watching? So if you want to receive notices for when we go live, Fly Nubian Money goes live every single day. That's Monday through Friday at 1 p.m. to 2 p.m. Eastern Standard Time. So if you don't know, now you know. All you have to do is text the word Queens. That's Queens. That's Queens to 87948. That's 87948. That's Queens to 87948. Yes?
If somebody don't text the word Queens 87948 today, it's going to be some consequences and repercussions. It's going to be some slow singing and some flower bringing. Y'all don't text the word Queens 87948. With the upcoming administration, we know that this administration is very pro-corporation, very pro-corporate greed. And we're going to see a lot of lobbying for more of these corporations, more so than for the common, because of course that's socialism, right? If the common people, helping the common people is more socialism, and we got the whole trickle down effect. And I'm wondering what's going to be the outcome, or are we going to have more vigilantes like this young man with what's coming up, what's getting ready to come down the pipe? That's a question I want to pose to you. But before we get there, I want to look at the video about this young man and what he went through and what supposedly prompted this whole killing.
He did it for his mother, according to his manifesto. She suffered from nerve neuropathy ever since the age of 31. He watched her suffer. He says that all her claims were delayed and denied, but that it is the foundation of this country. He said that on a good day, it felt like his mother's legs were immersed in ice. On a bad day, it felt like his mother's legs were clamped in a machine shop vise, screwed down to where the crank stopped turning, then tightened further down until her bones splintered. She had more bad days than good and crawled to the bathroom on her hands and knees. UnitedHealthcare limited specialist consultations to twice per year. They refused to cover advanced imagery. They kept changing the procedures. First, his mom was told to fax the notes. Then they said they needed a hard copy so it could be mailed. With every delay, his anger surged. He doesn't blame the doctors or the nurses. He blames UnitedHealthcare.
He said,
No, can't hear.
can you hear me now? No?
Yeah.
Yes?
Yeah, I can hear you now. Yeah.
Okay. Somebody said in the comments, free Luigi 2025 personage. And after seeing that, it's like, yeah, free Luigi. When you think about watching this man's mom suffer day in and day out, on a good day, she's in excruciating pain. But what happens when she's in a bad day? And so the smile on his face was probably reflective of the relief he felt in all the years of watching his mom absolutely suffer. So going back to my question about, the bureaucracy, Dr. Felice, of this new administration, what do you think?
I'm always going to tell y'all to stay positive, right? I think that there's a new generation, and I think they get on bandwagons and they copycat, right? And I don't think that they think all things all the way through. There's a possibility for both things to happen. There's a possibility for things to get better, possibly. And so we have to stay there. But I'm with Athena. We're going to have to take things into our own hands, and we're going to have to choose to take care of ourselves. We cannot depend on government. We cannot depend on companies to do what's right for us. And if you're going to sit around waiting for that to happen, then you're going to be miserable, and you're going to be depressed, and you're going to be angry, and you're going to be possibly the next vigilante. And so, I'm just going to be very transparent. I love vegetables. And I remember like 2 years ago, I was going into the supermarket, literally having tissy fits over how much it was for me to buy just regular vegetables. And it hit me, girl, you got some dirt. Go and plant your own stuff. And that's exactly what I did, y'all. I'm so serious. I got that angry that I started planting my own stuff.
What did you start planting?
So I planted green peppers, and I planted tomatoes. Last year I did some green beans, and what else did I do? This year I'm going to do a jalapeno too. But I started doing that and bringing it into my own house, and I felt so much better. Why? Because honestly, those things are supposed to be free. Guess how I know?
From the earth.
Because it's got a seed in it. And because it's got a seed, it's supposed to be free. And so what are those things? We got to take those things back.
Yeah.
And equip ourselves. And I didn't have no pesticide worries.
Right.
Like Athena said, it came straight from my deck to the kitchen. So deck to kitchen. Right. So I'm just saying we got to take things into our own hand. We got to get back to where our ancestors knew. Our ancestors knew some stuff.
Yeah.
And so we got to go back and pull from the back to the present how to take care of ourselves. I am not dependent upon UnitedHealthcare or the next administration for my individual health. I'm not going to do it.
You know what I think, Dr. Felice, with the power of the internet, we no longer have to rely on just practitioners in their thought process and how they are diagnosing us. We can get a lot of the information that we need on the internet. The internet has made the world so small. One of the ladies in my Net 7 collective cohort is a doctor. She's a general practitioner. And she said the only thing that they taught her in medical school was how to medicate people. That's it. And so she's transforming, and her name is Dr. Shirley Jones. I wish I had her information because I would certainly send you guys her information. But what she's done is she's changed her whole practice, and she's added a holistic care. And so she helps people get off of the medicine, because that's what they teach. They get paid extra to medicate you. So, you know,
But
if
can you imagine though
what
how we would disrupt systems by doing that? Can you imagine how we can disrupt the pharmaceutical industry?
right?
How we
Yeah.
can disrupt the healthcare industry if we
Yeah.
all took it upon ourselves to say
Right.
not anymore.
Right.
And to really change, because the reason our diets are so bad for African Americans, you remember they gave us the slop, they gave us the intestines.
They gave
That's
us
how
the
right.
chitlins.
They gave us the chitlins, and we made lemonade, right? And so that's how we have a history of bad food, but that is not our ancestry. So we got to go
100%.
back to doing what's right and what's healthy and disrupt systems by doing what's right for us individually and collectively.
Right. Thank you for that. So from a policy perspective, Vanessa, going into the new year, to the new administration, what are your thoughts? Because I know you read up on all this stuff.
Yeah, and actually, you know what we did? I did an in-depth research paper on access to healthy foods in inner cities across America. And what I found in that is that inner city, there are really no access to healthy food options in inner cities. And when you go in their grocery stores, they don't have fresh produce. They don't get local produced food. It's almost catered. It's more fried foods, more liquor stores. This is in every inner city community across America. So going back to what Dr. Felice and Athena was saying is that it has to come from the home at some point where we have to start educating our children about how they are poisoning us. Like that's literally poison. When you see when you and then when you go to these suburban communities, oh, they got farmers markets, fresh produce. I mean, you go like walking into the grocery store, it's a completely different experience. It makes you salivate over an apple or a pear or whatever because they make it look enticing, like it's marketed differently. So I just think overall, like we have to kind of re-educate ourselves in what healthy food options there are. So that's one element of it from a policy perspective. The second option is or the second opinion of mine is that I took care of my father for about a decade. My dad was blind. He was amputated below the knee. He couldn't walk. And he had a lot of health ailments, kidneys. I mean, you name it, he had it. So I had to basically get to have 24-hour care for him. But you know, I had a lot of issues getting his claims processed. And my dad was a veteran. He was 100% disabled veteran. And there's no way in hell that you should go fight for this country and then you can't get the health care that you deserve in America. That is a complete
100%.
disgrace. But what I realized is that if you don't have anyone advocating for you, then you will literally fall through the system. It was like a full-time job advocating for my father for him to get certain health benefits. And someone mentioned in the comments that it's almost like you have to be an attorney to navigate the system in order to get your claims processed. So I mean, for the ailments that we can deal with health wise, we have to re-educate ourselves and start eating healthier and actually teaching. Like I teach Sanaa, you know, to each his own, but my daughter's 6. I tell her, if you eat all that sugar, there's a strong possibility you might have diabetes and your leg may get cut off. I had some people, oh, you shouldn't say, no, I am going to tell her that. Sugar is not good for her. Sugar causes diseases. Sugar causes your teeth fall out. Sugar will cause you to be diseased and lose limbs. So, I mean, and she understands it. My daughter will reach for fruit, apples. I mean, because this is like what we've been teaching her. So, but for the ailments that can't be necessarily remedied with food, we as a community, we have to start advocating for one another.
100%. We're going to go to a commercial, but Deborah Will Win said they're called food deserts. What you described is called a food desert, and you will not see a grocery store with fresh foods in the hood. You will not see anything with economies. You will not see big box stores. It's also part of the urban decay. That's by design. You know, I'm always go back to white supremacy. That's part of the design to destroy us as Black people. And we're going to get into it when we get back from this commercial.
You want to grow your money and not blow your money, as Constance says, check us out at flynubianmoney.com. There's all kinds of resources, programs, videos, resources. In 2024, there's no reason to be broke when there's information all around us. So get your money right. flynubianmoney.com.
Yo, Get your money, ladies. Come on, come with me. Get your money right. Come on, doctor. There we go. There we go. We're not doing the hands like Dr. Joe. We doing the sis. But the food deserts that's one of the things that I believe that is an attack on Black people. When you have these children that are getting up and getting ready to go to school, they stopping by the liquor store, because they're gonna pass by how many liquor stores on the way to school. They're gonna get them some hot Cheetos and an orange soda. That's their breakfast. Then they go to school and they're unproductive. They don't have a healthy lunch. And then you wonder why they're hyperactive and they can't think properly. And then they end up with these bad habits. And then there's obesity in our communities. And all of this is because they intentionally do. We want good food too. And so we got to travel across town to go get some fruit and vegetables. It is a sin and a shame before God. But I'm so glad what you said, Dr. Felice, is, you know what? I thought about this shit. Like, this vegetables is expensive. Let me go ahead and plant some myself. We could do the same thing. And you don't have to have a house. You could do a bed, right? The bed thing. When you said that, that's what I was thinking. Like, oh,
no. I have a raised bed. Like, I'm not bending down, y'all. Like, I'm not doing no stuff on my knees and hurting my back. It is raised up. Not only that, somebody said in the thing, well, if you live in an apartment, well, my daughter bought me the thing where I can start planting vegetables in my house. So it's real slender. Yeah, and so you're able to do vegetables right in your. I was going to get it
in your house,
in your apartment. Yeah, you can do it.
I love that,
and that's what I tell people. So all that Starbucks change that you're using or your Dunkin' Donuts money, put that aside and go get you one of those things, and start getting and making your food in your apartment.
Yes, Hunty, I love that. Thank you for that, Athena. What are your thoughts in terms of like the bureaucracy and what's getting ready to come down the pipe with the new administration?
Well, the new administration, I'm interested to see how, especially with Elon, the Department of Government Efficiency, because clearly healthcare is a part of the sector that needs a lot of efficiencies, right? I do think that there needs to be some form of healthcare reform, because what I know and understand is when I started my career as a CPA, I used to audit insurance companies, and every insurance company is heavily regulated. Because what most people don't understand is that the money that they pay in premiums and the money that your employer also pays, because about over 60% of people in the US is private insurance, with half of that being from having their job pays for that, right? So for example, if you're paying $200 a month as your premium, your share that your employer pays, oftentimes your employer is paying $800 a month as well, right? And how these insurance companies profits is then they take your money, the premiums that you pay, put it in the market and take profits from there. So I think us understanding how they even make money is important, right? Wow. So now when it comes time for you now to pay, to submit for a claim, they're making estimates on whatever their pool of people are, if it's an individual, what your estimate is, so that whatever they charge you is more than what you will actually make a claim on. They're like kind of using, I forgot what, actuarial science to figure that out, right? So with them using AI to sort through people to deny claims, and that is why I'm trying and pushing so hard for us to embrace AI, because these people are using it against you. So you might as well learn how to use it for yourself, right? This is something that is definitely going to see a trickle effect down in the future. Now, I do think from an insurer standpoint, we need to hold these companies accountable for actually granting people the claims they rightly deserve, and not deny people off of a simple error or because the description isn't just so, because they use the legalities, and obviously they lobby for these legalities to get around that, right? A resource that I want to share with the audience as well, I typed it in the chat. It's called fairhealthconsumer.org. fairhealthconsumer.org. You can go at this website, and whenever you have a procedure, whether it's medical, hospital costs, dental services, what I used to do, I would ask for the codes for the procedures. And you can actually look up the codes and compare cost of what is legally allowed for them to charge, and also where it might be more affordable for you to actually get certain procedures. So this is a resource that
I don't see the link. Oh, it's right there. Okay, fairhealthconsumer.org.
It's on the screen.
Can we put it
So
in the comments too for the people to click on
yes,
it?
put it in the comments. This is a resource people can use as well. We also need to take things into our own hands, right? When we're talking about these food deserts, which is a real thing and something I had to learn, because I grew up in Jamaica, where you can literally pick stuff off of your backyard and go about your business, or where I live in America. Obviously, I'm not around a food desert, but I remember a story of a young man in Detroit, Black man, realized his area had a food desert, crowdfunded, and started his own neighborhood grocery. His name is Raphael Wright, and his store is called the Neighborhood Grocery in Detroit, right? So we need to galvanize and put our resources together and advocate for ourselves and be the change that we want to see in our community when it comes to our healthcare.
Yeah. Thank you for that. And thank you for all those resources, because at the end of the day, when we come on here, we ain't coming here just to yap. Like my kids say, the young people say yapping, y'all yap. We ain't here just to be yapping. We're here to actually give you resources and actually try to figure out what the solution is and how can we move our community forward as African Americans so that we can live long. Because one of the things, y'all, is they are so afraid of us. That's the reason why there is an attack on Black people, is because they are afraid of us, because we are powerful and we are resilient and we are overcomers. And the reason why you see all of these attacks with the music and with the drugs and even with the urban decay and the food deserts is because they know how powerful we are, and yet we overcome. And this is also something that we can overcome as well. What's so funny with this administration and with all of the bureaucracy that we see within the healthcare system, the CEO of UnitedHealthcare, I think, was he with UnitedHealthcare Group? Just a couple of days later, he said to his, they leaked audio to his people, and he said that that they're going to have to guard against what he calls unnecessary care, that they're going to try to deny more claims, that they're going to try to pay less, even after this other guy had just gotten killed for this very thing. They haven't learned their lesson. They're still talking about doing it. I do want to look at the reaction that people had from the video that this gentleman did, and I want to know what your reaction was. What do you think? Do you think this was a good thing? Do you think he did the work, or did he do it? So Mary Johnson said, I understand, because they keep changing and denying medications recommended by my doctors. Plus, the cost of my share for the medication is unaffordable. Norman said, listen, but I understand. Delisa said, justified to me. Angela Childer said, we have a messed up healthcare system. And the thing about it is, nobody's doing anything to fix it. They just add more paperwork on top of it. Bianca Hodge says, well, when insurance companies deny life-saving treatments, they're essentially making decisions that will lead to the death of a loved one. To me, that makes them killers. Nobody's right here. People are tired. I personally think we're heading into a light vigilante era. It's interesting to observe. Is he being held as a hero, or do people understand his frustrations, and or do people just not care about a rich white man being killed at this time? Is he a hero? Is he doing the work of the Lord, or doing the work of the devil? Not saying I agree, but it is because so many people are denied life-saving meds and treatments from insurance companies. People are sick of insurance companies doing them wrong. And it goes back to what you said, Dr. Felice, like even for you, a medical professional, just for one patient, you don't even want to be dealing with this stuff, because I don't have time. I don't have the capacity to be on the phone for an hour trying to get a $40 copay or whatever it is from these people's insurance. Like, they've made it so hard. Do you think Obamacare made it better or worse?
I think they made it worse, right? Because
Why?
I think what happened when Obamacare came out, insurance companies got together, galvanized, strategized about how they was going to get their money back. And so I think they actually made it where I know I was still working in corporate America when Obamacare came out, and my copay went up. They switched from copays to high deductibles. Right. And that's when health saving accounts came out. They tried to trick you into thinking, oh, now you get a health savings account. Well, that's my money. I'm still paying for my own stuff. And they tried to make me think it was doing something. Then they did the FSA, but you got to hurry up and make sure you spend that money at the end of the year, or you lose your money. So I think it got worse. I know a lot of people was able to finally get insurance, but if you think about it, people always say it's the poor and the very rich who have the very best healthcare, because working in a hospital for 5 years, you cannot deny somebody healthcare if they come through those doors. Now, if you're middle class, though, before you have a procedure, you sit down with a patient care advocate and they want to know before you go into that thing to get anything done, how you going to pay them back. But if you don't have money, you don't necessarily go through those hoops. And if you do have money, it doesn't matter. You can pay for it. So it is the middle class citizen that is getting pummeled to death with healthcare that does not look out for them necessarily. And so I think it got worse. I know I didn't see, I paid more when Obamacare came out, though I do know that some people say they benefited from it, and I'm okay with that. I just didn't think that it made things better.
Okay. For me as a self-employed person, it did make it better for me because it made it accessible. And as a self-employed person, you can kind of, determine what your salary is in order to be able to qualify for certain health cares, right? What about for you, Athena? Do you think it made it better for you or worse?
I think that even when I look at the healthcare system, I want to touch on something that Felice said, right? We live in this America, right? The middle class always which is shrinking, always have to prop up everybody. Like we prop up the rich and then we prop up the poor, because the reason why people who meet a certain poverty threshold get good health care is because the state is going to reimburse them for meeting. They build a state. The state sends them money for people who meet that threshold. So at the end of the day, it always comes back to the money. It always comes back to where can I get the money from? And with the rich, they have the money so they can pay. The poor, the money's coming from the state. So the middle class is always the person who has to have proof of health insurance before anyone can touch you. And that is something that we need to even, deal with what is going on in America. Now with what is now known as Obamacare, right? With any new legislation or practice, there is going to be some pros and cons. Yes, it did help self-employed individuals to get access to their own healthcare, but also self-employed individuals can get access to their healthcare through private insurance, where you can get your own quote from an insurance broker. You can also, even if you were, say you're self-employed, QuickBooks has a feature, Gusto has a feature where you can participate in not only setting up your own payroll and pay yourself, but also getting your own healthcare. So there are options for you. It's just that this is information that is not always widely and publicly accessible, and that is for a reason, right? Because once something becomes very accessible, then they're going to re-strategize, like Felice said, to try to still ensure a profit. I think this situation illuminates a problem in American society where we're so profit-driven versus people-driven, to the point where people start to have these brooding resentments and can cause situations like this to happen, to where the CEO is killed. Now, do I think that the CEO deserved to die? No. I do think his lack of empathy and sympathy from the general public does indicate how America feels right now. And like I said before, it really feels like we are on the verge of great civil unrest because of years of being tired of certain things in play. However, the beauty and I guess the silver lining in what Luigi has done is he definitely brought to mainstream media to bring this issue to the forefront for us to address this ugly situation and call for reform. And I'm interested to see how the Trump administration is going to address this.
That's the real question, is how is the Trump administration going to address this? And is the other question is this going to wake other CEOs of companies up? One, is this going to wake up the sleeping giant? And then two, is this going to wake up more vigilantes in other arenas? We're going to talk about it when we come back from commercial.
Fly Nubian Money is now on Spotify. Yes, yes, yes. We are on Spotify. So if you can't watch us, you can listen to us. All you have to do is search Fly Nubian Money and we will appear. All of our episodes. Make sure that you leave a 5-star rating and reviews so other people that come along and are looking for a good show to watch, they'll follow us too. If you are interested in being on Fly Nubian Money, sorry, I don't have any spaces. I'm just playing. If you are interested in being a queen or a king on Fly Nubian Money for the day, please reach out to me. I'm at info@realvirtual.net. That's info@realvirtual.net. Also, if you need help with your business, go ahead and send me an email for that too. Okay. I've said enough. Now back to the show.
Hey, Vanessa, what are your thoughts?
I think Obamacare helped. I think like any policy, when you implement a new policy in such a broad, it's a federal policy. So I think we have so many people in the United States, you have all these states. So implementing it, there's going to be probably 25 years of bumps and roads until you figure out how to get something right. And then we do live in a capitalistic society. So as Dr. Felice mentioned, yeah, you're going to have insurance companies swerving, trying to figure out how they can avoid costs. But overall, I knew a lot of people before Obamacare was passed that couldn't even get insurance, or insurance was extremely inaccessible due to the cost. So you had a lot of people uninsured. I think the cost to have people, I think all people should be insured medically. I think it should be a necessity for people to have the right to health care. I think that when you run into an issue of you don't have health care, and you have a procedure that you need done, you could bankrupt yourself, like trying to have a procedure. So I think healthcare is necessary. I don't know about every other state, but in California, how they do it is like you submit your income. And once again, Constance, to your point, it definitely helped me because I'm self-employed and I can say what I want to make and I pay at that price.
We're not saying that. We write off things,
Yeah,
and
you write
we
off,
make
yeah.
what we can as businesses.
True, very true. However, at the end of the day, you have more control of what you make. Is the
Amen.
So the bottom line is, if you are making $50,000-$60,000 a year in California, then your health insurance is based on that number. So it tries to tier up basically what you make. So if you're making, I don't know, 2-3 million, then you have zero. You have zero coverage from the government. So I think that system. I mean, I believe in that system. I think that if people are making $30,000 a year, how are they going to pay $500-$600 healthcare insurance? That's
Right.
impossible. So I think the idea of Obamacare is to create a fair system, but the problem is that we have insurance companies and pharmaceutical companies for profit, and I just don't think the two should mix. I think that you should have it should be streamlined. There should be a lot of laws in place so that insurance companies are not profiting $50-$60 billion a year off denied claims. I mean, that seems very unethical. So
100%.
I mean,
that was the thing. He made more money off of denying claims. Ooh, we're gonna talk about it, but let's take a look at this video of look at this guy. They just arrested him. I'm surprised people are not cheering him on.
As completely out of touch and it's an insult to the intelligence of the American people and the lived experience.
What do you say? It's an insult to the American people. What do you say?
Listen, I haven't seen any evidence that says that he's the shooter. So that's like I said earlier, and I wasn't kidding around. A couple of things: if you're going to report something, report accurately, and remember. And this is not just a small thing. The fundamental concept of American justice is a presumption of innocence, and until you're proven guilty beyond a reasonable doubt. And I've seen zero evidence at this point.
Listen, he said the intelligence of the American people. This is an insult to the intelligence of the American people.
What part was the insult? Was it the insurance companies, or was it the fact that he's being railroaded? Because that's what other people are saying is, he's the fall guy. He's a scapegoat. He's not. He's not for real.
He might be the fall guy, but somebody did it, right? And I think that that was calculated, right? That was calculated to put this issue to the forefront as well. I do think that even within the coming months, and we're going to touch back on this. After this CEO got killed, they posted his job on LinkedIn. Right. So the other issue that we need to also address is that America is a corporation, y'all. America is about business. America is about commerce. Y'all mule and slave yourselves for these jobs, not taking y'all breaks, not taking y'all PTOs, not focusing on creating the business that you need to make, not focusing on learning different innovative tools like AI to better your life and better your business. And you can literally die for the company. Because if he wasn't working for that company, he would not have gotten shot, according to the situation. And they will post your job the next day. He was on his way to a meeting. And they continued the meeting without him. So I think this is something that we all of us need to consider and focus on what matters, which is your family, which is your, the love in your life, which is your own business and enterprise. Because another thing that needs to be looked at when it comes to, corporations, they'll cut you a check and that is it. They don't necessarily love you back, right? Is he being memorialized by this company? Probably not, if they have his job up in 30 seconds after he done died for it.
But even if they do memorialize him, what is that going to mean to a dead man? Absolutely nothing.
And not only that, but it's just, he's the fall guy. But I mean, he's the fall guy because he's a CEO. But how many people above him or below him were denying, the claims? It wasn't just him. It was a whole collaborative effort to get more money for the corporation. So I think, what does it look like for other CEOs? Like, are they going to be scared? Are they,
What do you think? What do you think mentally, Dr. Felice, how we should move forward? Because I think it opened up the eyes of a lot of people. Some people didn't know the dire straits of the healthcare system. Some people don't have that understanding. We don't have, especially when you look at the African American community, right? Because that's who we're concerned with. And when you look at the disproportionate effect of chronic diseases, we have hypertension at a higher rate. We have diabetes. We have heart disease. Our adults are 40% more likely to have high blood pressure than white people, and we're more likely to experience complications such as strokes and kidney disease. That's the statistic for Black people. Our access to quality healthcare is often limited for us due to factors like geographic location, lack of insurance. That's why Obamacare was so important for us. And then systemic bias. And that's what I really want to get into in the healthcare system. Black Americans are less likely to have regular healthcare provider compared to white Americans. And when we look at the systemic issues, when you look at the racial bias in healthcare treatment, that is a significant issue. Black patients are less likely to receive a pain management. Yes. Even when experiencing similar symptoms as white patients. They actually teach this in medical school, that our pain tolerance is higher than white people. They don't take our pain serious. This bias is also evident. Right? So when we look at the disparities in the healthcare system, and then you have, especially a lot of boomers, right? People our parents' age who are going. My dad's at the VA maybe 2-3 times a week almost. I mean, he's always there. They don't give him proper treatment. They give him the bare minimum, just like you were saying with your dad, Vanessa. How do we advocate for ourselves? How do we get that knowledge and advocate and make sure that they're doing what it is that they're supposed to be doing? What can we do?
So that's a great question. And that segues into the nonprofit that I co-founded with my co-founder, Dr. Davita Hammer. We have what we call States of Wellness, Inc., where we go into all the 50 states and build teams of trust, right? And we set up health clinics where we educate the community about how to advocate. We give you questions that you need to ask when you go into those doctor's offices. And then in the states that we go into, we build those teams of trust. We are building teams of trust with people of color who are willing to see and help and track and follow people of color. And so those are the things that we have to do. We have to educate ourselves. Like we teach people, don't you leave your doctor's office until you get your answers.
Dr. Felice, I remember seeing a video of a Black lady who was at the hospital, and she didn't want to leave, and they made her leave, and she did not want to leave, and they got security and they put her out on the street, and she ended up dying.
And that's how they're treating our people. And guess how it's trickling down? So I see clients, I see African American women who are afraid to get pregnant. And when they are pregnant, extreme anxiety because they know, right? Yes, because You having a baby in this country is like in a less than a third world country. And I don't know why people think that our healthcare system is not good for Black and brown people. It is that or even worse of a third world country. And I went to Kenya last year. And ran into a professor from Boston University who she won a Pulitzer Prize for writing the book on the genocide that happened in Kenya. And she advised me, she said, now she was Caucasian. She says, you need to come over here and get an apartment or someplace to live, get it in Kenya. She says, the healthcare is excellent. She had a best friend. Yes, she had a best friend who had triple bypass heart surgery. Guess how much he paid total?
How much?
1,000 American dollars for triple bypass heart surgery. That was excellent. And
we about to go to Kenya, y'all.
She told me to go ahead and get, and her son was getting ready to form the first tea shop in Kenya because more Kenyans drink tea than they do coffee. And so she's been going back and forth to Africa for like the last 20 years. And she has an apartment. And she also shared with me, she says, you would want to retire here because they take very good care of the elderly. So you have our counterparts who are going over to Africa for the healthcare and for their aftercare when they get older. And so what does that even say about us that you have no one to leave, right, for better healthcare? So that says a lot. And why was it 1,000? So you mean to tell me that you really could have triple heart bypass surgery for $1,000?
Because they're there to serve.
170.
They're not there to profit.
Yeah.
Incredible. And so you have people, you have women in our country who are afraid to give birth. In our country, and they're dealing with real anxiety about it. That is real. And we have to talk through it. And we have to teach them how to advocate for themselves. We have to teach them and there are options. You got birthing centers now. You've got a lot of people who are like, forming together and creating birthing centers, getting our doulas back, right? Getting those, services back to make sure that
I feel like we need a bullhorn to tell people how to advocate for themselves, because again, that's another part of this whole idea of the supremacy and the oppression is what they do in medical and healthcare. And it's y'all, they coming at us in every aspect of our lives, and we're still resilient, but we just need more advocacy. And so I'm so glad of what you're doing, Dr. Fleece. That needs to be put on a bigger platform because people need to hear what it is that you're doing. I think that's awesome. One of the things that you said, Vanessa, was about advocating for your father was a full-time job. What did that look like for you?
A lot of going back and forth on emails, a lot of Googling, a lot of, like you said, reading, researching things for myself. When I got my father, he was on all sorts of medication. He was over medicated. The VA sends pills out like, they're sending pills out left and right so they can build the insurance company. But over the course of a decade, I got him off of, half of the medication just through really going back and forth with his doctors, asking questions. I mean, they knew that he had someone there to show up, working with his social worker, really just using every avenue. But like I said, I understand the time. People don't have the time to do that because like I said, it's a full-time job. So it's just really hard to advocate. But, if anybody is dealing with the VA, I know, Constance, you said your dad, you have to log on to those portals because it makes things a little bit easier, use the technology, and email everybody. Really, I really leaned on the social worker, and I was like, listen, this is what I need. I need you to do this, this, and this, and this. And every day, this was an everyday thing. When I moved him here, they didn't even want to give me any type of PCA to come in. I mean, he couldn't walk to the restroom. He couldn't fix his own food. They didn't want to give me any help. And so even though I was working, they wanted like $12,000 for me to bring in full-time care. And they literally denied everything. So I had to keep fighting the system. They would give me 4 hours. They gave me 8 hours. So it's just a constant battle. Dr. Felice, when you come to LA, I really want to link up with your organization because especially with Black maternal health, because twice this happened to me. But I see now, especially with the legislation of us not being able to, people think that abortion is like a choice always, and it's not. I had a miscarriage, and I didn't miscarry naturally. I was telling the doctor, like, oh, I'm feeling pain. He said, okay, well, let's do a DNC. They put me under in a DNC. went in, did the DNC, and then afterwards, I was telling him for weeks, I had pain. I went into the doctor. There was pain. He was not listening to me. I'm at a job site with all men. I just start profusely bleeding. I'd never seen anything like this in my life. I literally thought I was going to die. I was in pain. Went in. This man had left the whole fetus inside of me. Not a little bit. Yes, not a little bit. The entire fetus. They say, "Oh, you're 3 months pregnant, but the fetus is demised." I said, "That's impossible. I just had a DNC 2 months ago or a month and a half ago."
So did you get like toxic shock syndrome?
Yeah, that it was sepsis. I was
Yeah.
going through, and I had to have an emergency surgery. They didn't want to touch me, by the way. The hospital that I went to in the emergency room, they didn't want to touch me because they knew that it was a legal issue. So I ended up having to go all the way back to the where I had initially got the procedure done. They had to do emergency surgery on me. I had 4 blood transfusions, and that was that. But there are women right now that are dying that are going through that exact same thing because the doctors now will not perform that same surgery. If you are septic because of a demise fetus due to a miscarriage, you can die if they don't go in and clean it out. Like your body will become infected, you will die. But they don't listen to Black women. And I've had a situation like this happen to me twice. I went through hell to change over all my medical stuff, and I found a Black OB. I just found a different medical team now. So it's really important too for us as women to really look at who our doctors are, research them, interview them. I interview doctors. I've Googled them. I read about, I literally interview doctors. But when you come to LA, please let me know because there's so much that I learned through that experience and how to just approach it and not listening to a doctor tell me that you're okay because they seem very like, oh, that's normal. That's normal. It isn't normal. I'm telling you that what I feel is not normal. And he didn't listen to me. So I could have died.
Yes,
So
you
I just
could've.
feel like that's a repetitive cycle, especially in Black maternal health. It happens a lot. And so you will always, if you follow me, you'll always see me posting about this stuff and kind of sharing my story because I think it's important for people to hear that when you hear the word abortion, whether you're conservative or not, abortion is not always a choice.
Right.
It's you got to there's situations where you medically need an abortion or you'll die. And those situations are killing women.
Absolutely. I will do that. Thank you.
Yeah. Athena, what do you think about the advocacy? What can we do as African Americans to advocate for ourselves?
I think that we need to, and I want to say this as I said this before, hope is not a strategy. We've been hoping for a long, long time. And we have made I think, in a lot of key factors, we're regressing actually. So we need to take accountability for ourselves in our own lives because nobody's doing it. Nobody is doing it. Right. So I think in order to advocate for ourselves, we need to invest in our own knowledge, invest in finding out, learning how these systems actually work so we know how to work within them. And also not taking things lying down, going through proper channels to challenge the system and authority. Look at Vanessa had to go through all this issue with the VA and all this personal stuff. She did not take things lying down because she knew that it was worth the fight for her, not only to have this story and to help people, but also to help her father and to help herself. So we need to look at these things and be serious about our own lives and be serious about the lives of our family. If you're serious about those things, then you will prioritize them. Unfortunately, or maybe it's just social media putting this on, but we seem to be serious about who paying what and 50-50 and gender war and,
Serious about the wrong shit.
whatever, versus being serious about learning about how our health insurance works, learning about how we can make more money, learning about the things that will actually be incremental improvements in our lives. So I think the first thing is always self-knowledge and also making the right investments. If you have money to buy a pair of Jordans, and if you have money to go to concerts, and you have money to do all these trickerization things, you need to take some of that money and invest in different avenues to help yourself. Invest in courses. Listen, I remember, and I'm starting a new community, by the way, but if you have money as a woman to buy wigs, to get to buy wigs. No, let's call it to buy wigs, to get all these intricate nail designs, to get you a 20, 40-inch bust down, to buy all these bags and shoes and all this other stuff. But you don't have money to invest in making your own money, but you have money to pay people to sugar daddy men to pay for you, then you have your priorities all messed up, right? So we need to just be smarter with the resources that we do have and learn how to delay instant gratification and think of the long term.
Good shit. Thank you for that. I think the bottom line, y'all, is that white supremacy is hitting us in every direction. Systematic racism is hitting us in every direction, healthcare being one of them. And I do believe that with the power of the internet, we have access to everything in our fingertips. And so we need to do more researching, and we definitely need to advocate. This information that we have, that you're listening to right now, share this with your friends, share this with your family, because we have family members. We got family members right now on that sugar. We got family members right now walking around with no toes, with no foot, with they leg halfway chopped off because we don't know how to eat well. Did you know diet and exercise can actually cure type 2 diabetes in some instances? Like, all you got to do is change what you eat. But we so concerned with eating them pig feet and hog maws that then we'd rather, instead of getting off of that, we'd rather just go ahead and get on some medication to reduce our sugar and keep eating the way we do. We have to change our mindset. Dr. Felice, I want to go to you for final thoughts. What are your final thoughts overall for Black people and how we can actually utilize the system to improve our situation?
Well, one of the ways is that we become educated on the right things, right? And so we start taking our individual and collective health a little bit more seriously. It is necessary that we as Black and brown people live longer and stronger. For whatever reason, we're leaving here earlier, and that is not going to help us build legacy wealth. We have got to be here to do that. And so we've got to start educating ourselves. We have to start learning how to advocate for ourselves. Do not leave rooms until you get your answers. And then we have to start helping one another figure this out, right? And so, like, I think you mentioned the one person who started their own grocery store. We're going to have to go back. We have a history of being able to take care of ourselves without anybody else's assistance. We got to go back to doing that because we're worth it. We're worth the work that is going to take for us to live longer, stronger, and be the kings and queens that we were on purpose to be.
Amen. Thank you for that. And that's the thing that we have to understand, is that we deserve everything that this world has to offer. We deserve to be in the rooms. We deserve to get proper health care. We deserve abundance. We deserve good lives. We don't have to be subjected to the things that they are putting on us. And I love the fact that you said that even in our apartments, whether it's in your backyard, on your deck, or in your apartment, we can actually be growing. Girl, you don't even know what you just did for me. And that was the price of admission for me right there, to understand and know that, you know what? F all of that. I don't have to worry about pesticides. I don't got to worry about anything. I can go ahead and grow my own fruit on my own green beans. All that. Yeah, we can do that. And I have a brown thumb. Everything that comes in this house that's alive dies. We don't figure this shit out. Athena, what are your final thoughts, dear?
All right, so I know I gave a word today and I gave a lot of information and resources. Final thoughts are this: go to fairhealthconsumer.org to check out and make sure not only are you getting the correct prices for your medical, dental, and other issues, but also you can find research where it could be more affordable. Another website I want to link is medicaltourism.com, because I forgot to mention that. I had a dental thing once and I was looking to go to Turkey to get it done, but between the flight costs and everything, it was going to be the same amount. So I just decided to do it here. But people often go to Mexico, Turkey, these different places that Felice said, Kenya, to get certain medical procedures done because it's more affordable than, unfortunately, where we live. So medicaltourism.com is another resource for you. Now, I want to touch on what happened to the CEO as well, right? This man died for that job, and they posted up his request for his replacement the next day. we cannot afford to put our trust in one basket. So now is the time. And also, we touched on how UnitedHealthcare was using AI to deny claims to make $50 billion in profit. So if the people who are oppressing us and denying us are using AI and other resources, then we should be too. So if you're interested in learning how to use AI to launch a business with effort and ease, you can find that at elevatewithathena.com, and also the Goddess Guide to Money, so you can have the finances to make sure that everything is straight with you so you can afford the care that you need. My name is Athena Gardner. I am the founder of We Wealth Women, and you can find everything, my social media, podcasts, and everything at elevatewithathena.com.
Wait. Great plug, Athena. Yes, all things AI. You see how she just rolled that in there? She said, listen, they use AI to deny your claims, and I'm gonna show you how to do AI to make you some shmoney. You see, y'all see the correlation? Go to elevatewithathena.com. Miss V, what's crack-a-lackin' Big Mac?
Oh man, Sydney, it's a lot. It's a lot of information that was given out today, and I love it. My approach is, in addition to advocating, let's teach our children. I think that the biggest thing that we can do is teach your children, your teenagers, what is healthy eating, right? Offer them fresh produce, fresh food. Stop giving these kids hot Cheetos, Takis, all this. That's poison. I think when you really present good options, good food options to children, they navigate to them. If you have good options on the road, that when they open the pantry, they'll go for the good option 9 times out of 10. So I think that's really important too, is the way that we raise our children. We need to start teaching them that health is a big issue, and the way that they eat is a direct consequence of their health and how they will lead their lives, and the implications of how healthy they'll be overall. Also, just I think it's important to just talk about health as a community. There is also a Black grocery store that I'm going to check out that was just open in LA. It's off Slauson. I forget the name of it, but the sister opened the fresh produce market. And so it's off Slauson. If you just Google Black owned grocery store and you're in the Los Angeles area, you can go check it out as well. I want to say that. In terms of where you can find me on Instagram at Vigo Paul. All my Linktree information is there. I run a construction company. I'm always about creating Black wealth and cash flow. Right now, if you're in the LA area, we're doing a special on ADUs. I've just renovated a few ADUs that are going to be rental properties for the property owners to create some cash flow. So hit me up if you have a property and you're interested in doing that in LA.
Thank you, darling. And I love the fact that everybody is working on different things to advocate for our community. The thing about it is, if you read the book Medical Apartheid, have you read that, Dr. Felice? Has anybody read Medical Apartheid by Harriet? Forget her name. Read that book, and it talks about all the experiments that have happened to African Americans over the course of
Henrietta Lacks.
Well, Henrietta Lacks is one of the people that she talks about, but there has been more. I mean, I'm talking about Harriet, whatever, the author of Medical Apartheid. Oh. So there's actually a book called Medical Apartheid, and but they talk about all of the experiments that have happened to African Americans. That we used to be the lab rats, y'all. Did y'all know that? We used to be the lab rats. So they used us. They didn't use any anesthesia on us during childbirth, and they were doing surgeries. We were the medical, the lab rats, and it's extended in many ways. And so there's a lot going on. And so we have to be, number one, educated. We got to be aware of our rights and our responsibilities. And if you know something, share it with other people. This information that you just learned from Dr. Felice, from Vanessa, from Athena, all of these links and resources, please share them with your community. Share this podcast, share this YouTube with your community, because it's so necessary. It's to the detriment of our lives and our health and our community as Black people. We need to understand nobody's going to fight for us like we are going to fight for us. Nobody's going to advocate for us like we are going to advocate for us. And so we need to have this information. Like I said, I wish we had a bullhorn where we could put all Dr. Felice's information out there, that the advocacy work that she's doing. We need that. Everybody needs to understand and know that, because our people are dying at record numbers and nobody cares but us. I'm not just talking about us here on the panel. I'm talking about you. I'm talking about people within our community. That more needs to be shared about this. So we thank you. And that's the reason why I absolutely love Fly Nubian Money. I love what we do on this network. I love the ladies that I get to engage with on a daily basis because they're so smart. They're so researched, and they're so highly intellectually stimulating. We get to have conversations about anything from Jay-Z, from the ratchet shit, all the way to healthcare. We do it all, and we gonna give you our perspective. You know what I'm saying? Listen, I could be bougie, but I could be ratchet too. I like to go to the galas, and I like to have the fish fries and everything else and play spades. We are all of that. As Black women, we are not a monolith. We do it all. And so that's why I love Fly Nubian Money, is because we come here every day to talk about things that affect us as Black people. And so we appreciate you coming here and you joining us every day at 10 a.m. Pacific, 1 p.m. Eastern. Now, again, if you want to get notified every time we go live, because not only is Miss Black Hollywood gonna get on our asses, but Dr. Boyce Watkins is gonna get on our ass, please text the word Queens to 87948. That's QUEENS to 87948. If y'all want me to keep my job, text word Queens to 87948. And also, every day we are on Spotify, y'all. So even if you can't see these lovely faces, you can actually listen to us on Spotify. So go to Spotify, search for Fly Nubian Money on Spotify. And if you want to learn how to grow your money and blow your money, go to flynubianmoney.com. And we got the Fly Nubian Money Club. Yes, where you're going to learn all things about wealth building. So if you want to get involved in the Fly Nubian Money Club, go to flynubianmoneyclub.com. My girl is telling me to wrap this shit up. I'm wrapping it up. And we're going to see y'all tomorrow. Same time, same back channel.